Good afternoon, everyone. Let me share my limited experience with intraoperative fluorescein angiography during vitrectomy and how does it help in the management of the cases. I don't have any financial disclosures. Basically, we need a digitally assisted vitrectomy system. The advantage is capability of processing the images. The second thing is the pass plan of vitrectomy is performed simultaneously on the same screen while implementing the intraoperative 3D-FA. Several angiographic findings and the retinal blood flow changes can be successfully displayed on the screen. Vitrectomy can be performed with a contrast imaging for a minimally invasive and reliable surgery. We all know the primary requisites for the digitally assisted vitrectomy system. Certain changes has to be done on the, this is an important table which shows what are the changes one should do on the panel to get while doing a 3D fluorescent angiographic assistomy. One, you should look at the iris slider, which should be 100% open if you're doing a 3D FA. The gain has to be increased. You have to play around with the filters. The red and the blue filter should be switched off and the saturation should be totally reduced to 0. 3D FA performed after a mid-peripheral vitrectomy for the amplification of fluorescence emitted from the injected contrast stage and settings of the engine is adjusted as shown previously. Basically, you need an excitation filter and the barrier filter. The excitation filter can be fitted to the light source as shown here. There will be a tray or a slide in the synergetic light system which can be used as an excitation filter. The interference filter can be fitted into a microscope, but the light pipe brightness should be reduced to about 60%, and you can inject an intravenous fluorescent angiography. Similar to what you see on after fluorescent injection, either you can have an hyperfluorescence or an hyperfluorescence based upon the lesion which you are seeing. 3D FA can confirm the size, location, and the neovascular status. Recent modification is instead of fitting onto the microscope, you can fit the excitation and barrier filters within the vitrectomy system as well as into the laser system so that you can avoid the fitting of the filter into the thing. These are the intraoperative views which clearly shows the CNP areas, capillary non-perfusion areas and the neovascular areas. Let me show a case of diabetic vitrectomy. It's a case with a pre-retinal hemorrhage with the membranes. Once you've done the membrane dissection and the clearance of the hemorrhage, peel the membranes. Let me go to the angiographic part straight away. Yeah. Once you inject a fluorescein angiography, you can clearly see the filling of the arteries and the veins, and you can identify the areas of capillary non-perfusion, which are the targeted areas which are abnormal areas, any fronts of neovascularization, where exactly do a laser. So in this area, there is a maximum leakage is there, so you can do a targeted laser or a targeted PRP to that area. So it will add a value to the existing visualizing system to how to treat it, and excessive laser and other things can be avoided. This is another case of diabetic vitrectomy with a vitreous hemorrhage. Yeah, you can easily see the membranes or the contrast of the vitreous also very well seen, and even the fibrovascular attachments, you can trim it. Laser marks are very well seen, and you can see the skip areas also. Once you have done that, you can selectively laser the areas which are suspicious or which needs further augmentation of the laser. Okay. Even the studies have shown the percentage of post-operative vitreous hemorrhage tends to be less in a digitally assisted fluorescent angiographic assisted vitrectomy when compared to the conventional vitrectomy, because you tend to treat all the lesions properly. Now let me show a case of a superior temporal BR vivo which has been lasered already. Once you inject the fluorescent angiographic dye, just observe in the superior temporal quadrant, there will be leakage of the fluorescein in the area of the neovascularization. It's an already being lasered eye. See the leakage. Even the vascular filling is very well appreciated, and you can on the contrast. So advantages is provides an angiographic information and perform the surgery in real time. Optimum retinal photocoagulation can be done to the CNP areas. Location of fibrovascular membranes can be clearly identified, and segmentation and delamination can be performed easily. Retinophotosexity is one of the concerns when performing an intraoperative FFA. Phototoxicity overcome by acquiring an angiography images by adjusting the iris slider and setting up the gain with moderate endoillumination intensity. Thank you for patient hearing.
Excellent. I think I liked the video. It was looking, I was operating in black and white, you know. I liked it. Something different. Very nice.
So what made you to do the fluorescein angiography on the table? Same information you could have got pre-operative.
So only thing, all these are non-iris cases, first of all, when you do it, because the angiography itself carries some risk factors associated with that, because you're doing on a supine position, an on-table patient, and an anesthetic backup. The second thing is some additional information. The only thing which would added advantage is already lasered eyes, which are the areas to treat, and look into the specific areas of treatment. That is the only advantage, sir. Apart from that, I won't think. Yeah. But this can be applied to even to the, not only in, I showed only the vascular occlusion cases and the diabetic. It can be applied to the breakthrough hemorrhages in AMD patients and all. You can do an intraoperative FA and other things and all. It will add a value to that.
Ingenuity has different color filters.
Filters, yes.
So you interplay with that.
Filters and the gain.
Do you have any added advantage doing on the table FA compared to those filters?
That's the only thing, sir. One is the contrast, what you get for the dissection of the membranes and other things. The other thing is the targeted laser photocoagulation.
Which is this machine you're using?
Ingenuity.
Ingenuity, yes. Thanks, Doctor.
Okay,
Thank you so much.
thank you very